So our focus is to say, how do you improve the food system in order that you improve the affordability of a better quality diet for the poor in India? There is a direct connection between women's empowerment and nutrition. Not only their nutrition, but nutrition of their children.
Today we have with us Dr. Prabhu Pingali, founding director of the Tata-Cornell Institute for Agriculture and Nutrition. Dr. Prabhu is also professor in the Charles Dyson School of Applied Economics and Management with joint appointments in the Division of Nutritional Sciences and the Department of Global Development. Prior to moving to New York in June 2013, he was a deputy director for the Agriculture Development Division of the Bill and Melinda Gates Foundation from 2008 to 2013. He was also elected to the US National Academy of Sciences as a Foreign Fellow in May 2007. He was the president of the International Association of Agricultural Economists from 2003 to 2006 and elected fellow of the American Agricultural Economics Association in 2006. Lovely to have you joining us, Dr. Prabhu.
Thank you, Yamini. I'm really delighted to be here and to talk to you and to talk to Impactful Nutrition.
Thank you, sir.
POSHAN series.
So just to begin, sir, we would like to understand a little bit about your professional career and how you've been at this, great intersection of agriculture, economics, and now nutrition. So can you tell us a little bit about your journey?
Thank you. So I spent over 3 decades of my career working on agriculture development and agricultural economics issues, and very much focused on how do you increase agriculture productivity. So much of my early career was on looking at the Green Revolution, the impacts of the Green Revolution, looking at how do you increase the productivity of staple crops such as rice and wheat. And we've seen enormous productivity growth taking place in India and in other parts of the world. And with that, there's been big changes in incomes, and the whole drive of India becoming an emerging economy started with agriculture, as we know from the literature. But over time, when I kept looking at our successes, I also realized that despite the growth, despite productivity growth, we do see very stubbornly high levels of malnutrition and rural poverty. So even in areas where the Green Revolution was successful, you still see very high levels of malnutrition. And I kept saying, why is that happening? Because one would anticipate with growth in agriculture productivity, incomes grow, and with that you would see nutrition improving. But there was some disconnect there. And that got me more and more involved in looking at the nutrition side of the story, in addition to the productivity side of the story. And that's how I started to think about nutrition as an essential component of any agriculture development program. And fortunately, just about that time, I got appointed as the founding director of the Tata-Cornell Institute, which was very focused on agriculture and nutrition. And so we were able to build up this area of work over the last decade.
Right. So can you tell us, sir, a little bit about the vision with which TCI was set up, and what are some research areas that the Institute focuses on?
So TCI was set up in around 2013. And the whole vision behind this was very much along the lines that I've just talked about, which is that India, despite becoming an emerging economy, and India, despite having very high overall GDP growth rates over the past few decades, not so much in the last year or so, but over the past few decades, it's had significantly high GDP growth rates. yet it continues to be the world leader in malnutrition. It continues to be the world leader in child stunting. And today it's becoming very close to becoming a world leader in obesity levels.
Right.
So there are these big nutrition related challenges that India is facing, which seem to be disconnected to the trajectories on growth
Right.
that India has been experiencing.
Mm.
And that's been the reason, the motivation for setting up an institute that's very focused on addressing the nutrition problems in India. But what's unique about our institute is we look at addressing the nutrition problems through agriculture, through food, and through food systems. So our focus is to say, how do you improve the food system in order that you improve the affordability of a better quality diet for the poor in India? And so moving from staple grain oriented production systems to a more diversified production system that's rich in vegetables, fruit, livestock products, etc. Products that are rich in protein, in micronutrients, in vitamins, etc. So our focus is, how do you enhance the overall supply of this diversity in food? And also, how do you improve the affordability of these crops? Because traditionally, vegetables, fruit, etc., were relatively more expensive compared to rice or wheat. And so the challenge is, how do you bring those prices down so that the poor can afford many of these? So that's the way in which we've seen agriculture and nutrition coming together. But remember, if we can increase the productivity of these crops, then you're also increasing farmer incomes.
Mm-hmm.
So you're addressing the poverty problem at the same time.
Right.
And as people come out of poverty, their demand for this better nutrition also increases. So that's the overall structure that we've been looking at.
I think that's a very novel ideology that we've come across when it comes to tackling nutrition. And what's better is that it's even having an impact on poverty, which is so interconnected with the issue of malnutrition that we have in India. Tell us a little bit, sir, about this food systems approach and how have you been able to apply this ideology to India within your programs, and what sort of an impact have you seen emerging?
So when we think about food systems, we think about the entire food value chain, going from production all the way to the consumer. Right. So that's our overall view of a food system. Now, traditionally, Indian agriculture policy and Indian food policy was very much focused on improving staple grain productivity. So all issues around agriculture policy, from research, technology dissemination, to extension, to subsidies for fertilizers, for water, then the marketing system, the procurement system, everything was focused on staple grains. And as a result, the incentives for farmers in India was to move into staple grains. So you saw, in the 60s and 70s, there was large areas under millet production or pulses production. And those areas sort of disappeared and went into rice and wheat production. And so you had a very concentrated agriculture production systems around these crops. And one of our challenges was, how do you diversify? How do you go from rice and wheat to a more diversified food system, more nutritious food system? So increasing, as I mentioned earlier, vegetables, fruit, livestock product, pulses, and now increasingly looking at millets and going back to some of those more traditional crops. Right. And in order to do that, we we had programs working with several of our partners in India, NGO partners, especially in India, looking at how do you create models for diversification at the farm level? So how do you look at programs that teach farmers or give extension to farmers to grow vegetables, to have to grow pulses after rice or wheat, etc. To look at these more diversified production systems, and there are lots of models that allow you to do that. But I think the fundamental problem for us is unless the policy change happens, farmers don't have the incentives to make these changes in production systems. So a lot of our work has been looking at the policy side and creating evidence that a more diversified food system can lead to better nutrition. But coming back to this value chain, we've been looking at not just the production side, but also on the consumption side of the story. So we've been spending quite a bit of time looking at what are the most effective models for diet change behavior. Because also consumers themselves have been quite restrictive in terms of the diets that they consume. The diets are also predominantly staple grain oriented. So how do you diversify the diets? So what are some of the behavior change issues around that? And how do you create better demand for increased diversity in the diet? So we've been working at both ends of this chain in the food system.
It's very insightful to know, sir, that you were working across the board, and because just focusing a little bit, sir, now on the consumption side, like you mentioned, one of the biggest challenges that we face is micronutrient deficiency and this hidden form of hunger. That there is a great lack of awareness about it within the normal population, and there are just so many challenges when you look at tackling something like this. So can you tell us a little bit about how this form of hidden hunger can be tackled through a food systems approach, and what are the role that things like fortification, for example, are going to play in influencing this hidden hunger?
Right. So one can address hidden hunger through a variety of mechanisms. If you think about, so our main focus, which is on diversity of the food system, if we get the diversity of the food system right at the farm level, at the local market level, then you're addressing a major part of the micronutrient deficiency, especially if it's the affordability of a more diverse food is possible, and that food is accessible in local markets, etc. But that's a longer term, slow process that needs to happen. And as one promotes food system diversity, you're addressing the long-term problems of micronutrient deficiency. But there are ways in which one can look at this more immediately. And one of the ways in which you look at this more immediately is to look at fortification programs. And there's quite a bit of work on fortification. And there's a lot of the private sector companies that are working in food have been looking at fortification of wheat flour, of other types of flour, of milk, of oil, etc. And generally fortification has happened by adding iron or zinc or vitamins, etc., into food products. And you'll see many of the food companies in India marketing these products as healthy foods, etc. But the problem has been that these fortified foods have been accessible primarily to urban populations,
right?
Especially middle-class urban population, and not so much to the rural populations, the poor in the rural areas, and that's where the need is the most. And so that's the challenge in much of the fortification programs. So one of the ways in which we try to address that is to say, can we create opportunities that in rural areas for small-scale fortification programs? So we did an experiment in Gujarat where we provided village women's self-help groups with sachets of micronutrients, iron and vitamin micronutrient sachets. And each sachet is, can fortify about 15 kg of flour. Okay. So you take this sachet to the mill with your wheat or rice, or mainly rice paddy. And when you mill the grain and make rice flour, then you add the sachets, the powder in the sachet into that milling process. So you end up with flour that's fortified. And that way you have a local mechanism for fortification. Okay. And what we did was we promoted this as a social enterprise for women. So the women's self-help group would sell these sachets. Okay. And so each sachet would cost around 2 rupees or so. And for 2 rupees, you could get 15 kg of flour that's fortified. And that turned out to be a really great experiment because you could reach rural areas, and you create an income opportunity for rural women, and it became a major social enterprise. The problem we ran into is we couldn't get the back end of supply of sachets to happen through the private sector, because that's where we can't manufacture sachets on our own. We can certainly do an experiment. But these are the things where private sector could actually come in and help in this process. And this is where the private sector that's interested in the bottom of the pyramid sort of markets would benefit a lot from.
I think that's a fantastic approach, sir, if I may say so, especially the fact that there's an emphasis on the local community taking charge for their own health and well-being, and especially for the sustainability of the intervention as well. I think this is a fantastic model, and it's amazing to see how you're able to tackle so many different issues. You're looking at livelihood, empowerment, nutrition, and all through the fundamental view of agriculture. Now, sir, I just want to kind of end this interview. We've already discussed this before, but just want to understand from you that what you think are ways in which the private sector can collaborate with the approach that you have, and step in to really support and augment the efforts that you are undertaking, and specifically what role you think that platforms such as ours can play in encouraging this convergence.
Well, I think the private sector has to play a major role as you look forward. I think we've talked a little bit about the food fortification programs, and that's really important and needs to continue. But looking at how do you look at small-scale fortification, rural-based fortification program, improved access to fortified food for rural communities. These are areas where private sector can play a big role. But I think the longer-term impact of the private sector will come from tying urban demand for food diversity, especially middle-class demand for food diversity. As middle-class incomes are rising, the demand for fruits, vegetables, livestock products is increasing. Middle class is also becoming more conscious of their nutrition and health. So you see increased consumption of millets now in India that you didn't see even 10 years ago. You see increased consumption of pulses. And so what the private sector can do is to see how do you connect this rising demand in urban areas to increase supply from rural communities, right, and linking rural communities to these urban demand. And the way it can be done is the private sector can promote value chains where farmer producer organizations can produce these high value crops. And these value chains then connect that production to urban consumers. And not just through supermarkets, but supermarkets could be one part of it, but the entire retail chain in urban areas. I think that's the growth area. So if the private sector can promote farmer producer organizations to diversify their production systems and feed into the urban market, you're doing two things. You're improving their incomes, but you're also improving the local supply of more diverse food, even as you improve the access to urban populations. And finally, I think the private sector can play a big role in public-private partnerships in helping strengthen rural markets, and strengthen overall rural infrastructure for increasing the productivity and supply of this diverse food.
Right, so especially in India, where we see such a robust, infrastructure already existing with the ICDS centers, the Anganwadis, and the ASHA workers. So I think for the private sector to come and augment government efforts rather than reinventing the wheel is most definitely a worthwhile approach to take.
Right. Absolutely.
So with this, we would like to end our interview today. Thank you so much for being here with us. It's been a true pleasure to be discussing all things nutrition with you today. I think I'm feeling so enriched after learning about all the unique ways through which you're approaching not just nutrition, but so many allied and comorbid social issues that we see in India. So you've been a great value addition to the platform, and we look forward to having you back sometime again.
Thank you. It was my pleasure to talk to you.